We're picking up with Respiratory System Part 2 PowerPoint slides. We just finished talking about inspiration and expiration, and now we're going to move on and talk about the control of breathing. So when we breathe in, we know that's an involuntary process, and it originates in the pons and the medulla of the brainstem. You'll notice in this picture there's a nerve carrying a connection down to the diaphragm and intercostal muscles. This nerve is called the phrenic nerve. When the neurons in the pons and medulla, this respiratory center, send a nerve impulse, that nerve impulse travels down this phrenic nerve and it tells the diaphragm and these intercostal muscles to contract. Well, we know when those muscles contract, the response is an increased volume in your thoracic cavity. What happens to pressure? Pressure will decrease. So inspiration is a process that takes about 2 seconds. This phrenic nerve fires for about 2 seconds, and then it turns off. When it turns off, we are no longer telling these diaphragm and intercostal muscles to contract, so they relax. In fact, they relax for about 3 seconds. So what do you think happens to these muscles when they relax? How do they change the size of your thoracic cavity? Well, they make the volume of your thoracic cavity decrease. So I'm going to make a note over here. When those muscles relax, the volume will decrease, the pressure will now increase, and this leads to exhalation. We'll just go ahead and note over here, this leads to inhalation. So to review, the phrenic nerve controls the diaphragm and intercostal muscles. It fires a nerve impulse for about 2 seconds to the diaphragm and intercostals. They contract, you breathe in. When those muscles relax, it's about a 3-second time period, then we see the muscles return the thoracic cavity volume to their normal size and exhale. Okay, so we actually don't need forceful expiration unless we're doing some kind of work or have a respiratory disorder. If that is the case, then we may in fact use expiratory neurons to fire, forcing our bodies to push air out. So if you've been working hard, exercising hard, or perhaps have a respiratory disorder, we may activate additional muscles such as the trapezius or sternocleidomastoid to help force out air. But normally, as we've previously have talked, expiration is a passive process, not requiring any energy. So let's talk about the breathing rate. If you breathe in for 2 seconds and you breathe out for about 3 seconds, that leads to a normal respiration rate called eupnea. That's about 12 to 15 breaths per minute. Children may have a faster normal breathing rate, somewhere around 12 to 18 breaths per minute, but it depends on the person. But normally for adults, we're looking at around 12 to 15 breaths per minute. All right, dyspnea is an abnormal breathing rate. That's difficulty breathing or shortness of breath. Apnea, such as sleep apnea, means no breathing, so breathing has ceased with that condition. Hyperpnea, however, is forceful breathing. So if you've climbed the stairs in the 5,000 building and had to breathe hard by the time you reach that 4th floor, you've experienced a case of hyperpnea. So I want to make mention here, dyspnea doesn't necessarily mean that you've had a change in your respiration rate. Hyperpnea doesn't necessarily mean you've changed your respiration rate. But these two terms, hyperventilation and hypoventilation, do mean that you've changed your respiration rate. So let's talk about hypoventilation and hyperventilation for just a minute. Which one of these involves a faster than normal breathing rate? That one is hyperventilation. We know that slower than 12 to 15 breaths per minute is what we call hypoventilation. So let's talk about this for just a moment. Let's tackle hyperventilation first. That's a faster than normal breathing rate. If you decide that you're frightened by something, for instance, maybe a snake has crawled across your foot, you may hyperventilate. So you're excited. Your breathing rate increases. Well, what gas do you exhale out when you breathe faster? You exhale more CO2. You also inhale more oxygen. Let's talk about hypoventilation. Sometimes people hit their heads and they hypoventilate. The slower you breathe, the more CO2 you retain. So you exhale less CO2. And of course, if you're breathing really slow, let's say 5 breaths per minute, you inhale less oxygen. Let's do another example. Let's talk about holding your breath while you go for a swim. Obviously, you're not breathing, so which category would this fall under? Hyper or hypoventilation? That sounds like it's a better case for hypoventilation. So, if you are holding your breath while you swim, you exhale less CO2, that means you keep more CO2, right? And you inhale less oxygen. Let's talk about another situation. If somebody scares you, or if you've had some pain, oftentimes people will hyperventilate. What does that mean happens to their respiration rate? Respiration rate is faster. And so normally you breathe out CO2, you inhale oxygen, but in the case where you breathe faster, you remove more CO2 from your bloodstream and you bring in more oxygen to your bloodstream. So hold on to those thoughts and let's look at this for just a moment. This is called the bicarbonate buffer system. There's yet another influence on blood that has to do with your ventilation rate. And the influence on blood, of course, is pH. So this buffer system actually helps to maintain blood pH. You may recall that normal blood pH is 7.35 to 7.45. Let's make a note there. All right, do you recognize anything in this chemical equation? We've got carbon dioxide over here on the far left. Of course, that's water. This middle product here is carbonic acid. Acid should tell you something. Of course, that is hydrogen ions. And this last one down here, this is what we call a bicarbonate ion. How do you know it's an ion? Right there, that negative charge tells us it's an ion. Is it an anion or a cation? All right, so let's talk about carbon dioxide. When carbon dioxide is loaded into your bloodstream from your systemic cells, that carbon dioxide combines with the water of your bloodstream to form a middle product called carbonic acid. Carbonic acid is unstable, so it breaks apart into hydrogen ions and this bicarbonate. You can actually see the CO2 is carried in that bicarbonate ion. And that's how carbon dioxide is transferred back to your lungs, where it then returns to a gaseous state and you exhale it out. I want to focus not on the bicarbonate right now, but on that hydrogen ion. When you learned about the pH scale, you learned that 7.35 to 7.45 was considered a normal blood pH. All right, if you head below 7.35 or head above 7.45, we get into problematic territory. What do you call the condition when you head below 7.35? That one is acidosis. And above 7.45, that is alkalosis. I've heard people call it alkadosis, but it's not that, it's alkalosis. Okay, so when you breathe normally, 12 to 15 breaths per minute, you have an adequate amount of CO2 in your bloodstream. That means you have the right amount of CO2 in your bloodstream to keep you inside this normal pH, 7.35 to 7.45. Anything you do to alter your respiration rate, you're going to alter how much CO2 you have in your bloodstream. And if you alter the amount of CO2, you're ultimately altering the amount of hydrogen ions you have in your bloodstream. So let's talk again. If you breathe really slowly, let's say somebody fell, hit their head, they're breathing really slowly, they retain more CO2, what's going to happen to their hydrogen ion levels? Well, the more CO2 you've got, the more carbonic acid, and the more hydrogen ions you've got. So, do you head to acidosis or do you head to alkalosis? Well, the lower your pH means the more hydrogen ions you've got. Okay, so if you're retaining extra CO2, you're going to have extra hydrogens and your pH will drop. Let's go to a clean slide. Okay, so let's talk again. Let's talk about that 7.35 to 7.45. We know that's normal. We know up above is called alkalosis. We know falling below is called acidosis. Okay, so we know the more CO2 you have, the more hydrogens you'll have, the more acidic your blood becomes. But let's flip the tables. A few years ago, I cut my finger using a knife while I was trying to separate frozen chicken breast. I hyperventilated all the way to the urgent care. And by hyperventilating, I was blowing off more and more CO2. That means I was getting rid of the CO2 out of my bloodstream, and that gets rid of the hydrogens that were balancing my blood pH. So by the time I got to the urgent care, my fingers were tingly. I was having a case of alkalosis. So notice if you have too little CO2 in the bloodstream, you'll also have too few hydrogen ions. All right, so I should be specific here. These are not just any old alkalosis or acidosis conditions. These are called respiratory alkalosis and respiratory acidosis. Why? Because your respiratory system is responsible for maintaining bicarbonate in the bloodstream. Remember that one here. And of course, hydrogen ions have a big influence over your blood pH. So let me repeat. Changing your respiration rate can change not only the amount of CO2 you've got in your bloodstream, but it can also change your oxygen levels, and it can lead you into one of these problem areas, either respiratory alkalosis or respiratory acidosis. So let's recap using this screen here. We've got hyperventilation, breathing too fast, leads to removal of carbon dioxide. So that's too little CO2. Okay, that means you're breathing too fast. The CO2 is leaving your bloodstream. The less CO2 you have, the less hydrogens you've got, and your pH heads above 7.45. At the very same time, you have another situation happening. The faster you breathe, the more oxygen you bring into your system. So that's too much oxygen, which can be toxic to your cells. Okay, so these two, hypocapnia and respiratory alkalosis go hand in hand. Flip the tables to hypoventilation. This is breathing too slowly. That means the slower you breathe, the more CO2 you accumulate. So you accumulate more and more CO2. That can lead to too many hydrogens. That means you're going to drop below 7.35. And hypoxia means what? That's too little oxygen. Okay, so what I'm trying to communicate here is that we're looking at a setup for respiratory compensation. What we've talked about so far are just cause and effect. If I breathe too slow, this is what happens, or if I breathe too fast, this is what happens. Okay, so we're getting ready to kick this into high gear, and we're going to talk about control of respiration in case you do have a chemical imbalance in your bloodstream. Okay, so these pictures here kind of summarize some accompanying issues with respiratory acidosis and respiratory alkalosis. So I'll let you read over and look at those. And what I'd like to take you through is negative feedback control mechanisms. And you've got some problems here to look at. You've got stimuli, you've got effectors, and you've got a way to solve this problem. So I'm talking about page 75 in your course pack, and we're going to work through that negative feedback control of the respiration rate. And I'll pick you up in the next video on that.